Hello, I'm Matt Kaufenberg, physical therapist and owner of Perham Physical Therapy. Today we're going to talk about cervicogenic headaches. Those are headaches that are specifically caused by a neck dysfunction, something going on in the neck that is creating pain in the head. Cervicogenic headaches do account for 15 to 20% of all headaches. They are slightly different than migraines. A cervicogenic headache will be very intense in pain throughout the entire day. A migraine will often start at a low intensity and gradually build itself up. A cervicogenic headache will have a presentation in which neck movements create it or sustained postures will create it. The other thing that's fairly consistent with a cervicogenic headache is the location of the pain. Oftentimes the pain will start at the base of the skull, so it'll often start back in this area and it'll wrap around the head, so it'll come up over the head. A lot of times it's one-sided, and a lot of times it'll end right behind the base of the eye. So a lot of people will say, man, I've got this headache in my eye. A lot of times those are considered neck headaches or cervicogenic headaches. The source of the pain with a cervicogenic headache is called the facet joint. So what is a facet joint? A facet joint is where movements in the spine occur. So this is our spine. This is basically the base of the skull, and we're looking at somebody from behind. The facet joint is where movement occurs. So the facet joint, I'm not going to go up into the neck. I'm going to describe the facet more in the lower spine because it's a little bit easier to see. But where the bones of the spine meet, that is a facet joint. So looking in this area, that is our facet. So that facet can open or it can actually close down, which will create either flexion movements, forward bending movements, or backward motions or rotations. So those are our facet joints. Now with cervicogenic headaches, it has been shown that the first two facet joints are where the problems occur. So if you're looking at the joint between the first neck bone and the second neck bone, as well as the second and the third, they've done studies where they've actually injected those joints with saline, and it's actually mimicked that presentation of a cervicogenic headache. So why does someone get a head pain from a neck issue? It's called the convergence theory. So if we look at our little guy here, we've got a couple of nerves that'll converge into what's called the trigeminal cervical nucleus, or the TCN. So we've got our first three neck bones that each have a nerve root out of it. So these are the nerve roots coming out of the first three neck bones. Those then come up into the TCN. We then also have the trigeminal nerve, which basically supplies sensation within the face. That nerve also comes down into the TCN. So when the neck joint is stimulated, that stimulation goes up through the brain stem into the brain. It's processed in the brain. It comes back down. And what should happen is it should then come back down into the neck, and we should feel it in the neck. However, what will happen sometimes is it'll come up into the brain. It'll come back down into this area, and then it'll, in essence, go along the wrong train track, and it'll come back up into the head, and you'll have problems in the head. So neck problems can create head pain. And we treat that through spinal manipulation. We treat that through suboccipital release. We treat that through manual-based therapy. There have been great studies that have shown the significant improvements in headache with spinal manipulative therapy. One study in 2002 shows that 76% of patients had a greater than 50% recovery just with spinal manipulation alone. What was great about that study, too, is a year later they did a follow-up. 93 to 100% of those patients had a significant reduction in headache and a significant reduction in medication usage. The people who did not get spinal manipulation in that particular study actually had a 33% increase in medication usage. So if you have headaches, please give me a call. My number is 218-346-2464. I'd love to take a look at you. Thank you very much.
Thank you for watching Wellness for Life.